Hello everyone, this is Sumitra. I'm studying 3rd BSc Microbiology in Dr. NGP Arts and Science College. Here we are going to see about E. coli. E. coli was first described by Escherichs in 1885. It is the most important species encountered as human pathogen, and it is the most important and common aerobe to be harbored in the gut of humans and animals. After excreted in feces, it remains viable only for some days in the environment, and it is taken as a evidence for recent pollution with humans or animals in the detection of drinking water. And other species are less important as human pathogens. Example: Escherichia hermani and Escherichia vulgaris. And then morphology. It's a gram negative and rod shaped bacteria. It ranges from 0.6 to 0.7 nanometer in volume, and it is arranged singly or in pair. It is a non-sporing bacteria, and it is a motile, and it have peritrichous flagella. It is a capsulated bacteria. And then its habitat. Its primary habitat is in gastrointestinal tract of human and other warm-blooded animals, and it also present in mucus or the epithelium on the walls of intestine, and it is most commonly found in the colon of large intestine. And then cultural characteristic: it is a facultative anaerobes or aerobic. Its optimum temperature is 37 degrees celsius, and it have 6 to 7 ranges of pH, and it have a good growth in ordinary media itself. In nutrient agar, the colonies are large, thick, grayish white, moist, smooth, opaque, or translucent. In blood agar, it is big, circular, gray, and moist. It have a beta hemolytic colonies. In violet red bile agar, red colonies are formed. In Muller Hinton agar, pale straw colored was formed. In McConkey agar, pink colonies due to lactose fermentation, and it is a circular and moist and smooth. In Emendo agar, it is a green metallic sheen like shining. And in Eosin, it is a EMB agar. It is used for E. coli as selective medium. It shows metallic sheen. In Salmonella Shigella agar, pink colonies were found. And then biochemical properties: the catalase positive, indole positive, methyl red positive, Vogus proscar negative, oxidase negative, citrate negative, urease negative, and in triple sugar ion test it forms gas, acid, but an acid slant. It ferment glucose, lactose, mannitol, maltose, and it won't ferment sucrose. And types of E. coli: it have enterotoxigenic E. coli, enteropathogenic E. coli, enteroinvasive E. coli, enterohemorrhagic E. coli, enteroaggregative E. coli, and these five are diarrheogenic E. coli, which causes diarrhea, and uropathogenic E. coli, virotoxin producing E. coli, or cigar toxin producing E. coli. These three are UTI causing E. coli. And pathogenicity: this is transmitted by injection of contaminated foods and water. Incubation period is 3 to 4 days. An antigenic structure: E. coli possesses four surface antigens. First one somatics, and then flagellar, capsular, and fimbrial antigen. Serotyping of E. coli is based on agglutination with specific antisera directed against with surface antigen. So far, more than 170 antigen serotypes, 100 K serotypes, and 75 H serotypes of E. coli have been recognized. The strains of E. coli is designated based on the serotype number of its antigen. And then the virulence factor. First one, somatic or O antigen. It is a lipopolysaccharide. It is stable. Early ones are usually commensals of intestine, and the later ones are the diarrhea producing strains. Serotyping is done by slide agglutination with specific O antisera. O antigen is the most important virulence factor responsible for endotoxic activity, and it also protects the bacteria from phagocytosis and bactericidal effect of as complement. And then the flagellar or H antigen, it is heat, libel, and its presence make the bacteria motile and hence it contributing to the virulence. Name capsular or K antigen, it is the polysaccharide capsular antigen present on the envelope. It also contributes to virulence by inhibiting phagocytosis. It is expressed in uh, only few strains of E. coli, those causing neonatal meningitis, pyelonephritis, and septicemia. And fimbrial antigen, phylus, it is the organ of Atkinson. It helps in attachment and colonization. It is expressed in few strains, and various fimbrial antigens are CFA colonization factor antigen, mannose resistant fimbriae, and P fimbriae. And then toxins, the exotoxins secreted by E. coli are several types. First one, enterotoxins produced by diarrhea strains of E. coli, and it has three types. First one, heat libel toxin, heat stable toxin, and virocytotoxin. For and then hemolysin, it is produced most commonly by virulent strains of E. coli, especially by pyelonephritis strains. And then cytotoxic necrotizing factor and secreted autotransporter toxin, they are cytotoxic to bladder and kidney cells. And then siderospores, they are basically iron carriers. And then clinical manifestation, first one, UTI, urinary tract infection. It is caused by uropathogenic E. coli. It is single most common pathogen, accounting for 70 to 75 percentage of all cases of UTI. And these are its serotypes. And routes of spread, its ascending route and a descending route. The types, depending on the site involved, there are two types of UTI: lower UTI and upper UTI. In lower UTI, the site involved is a bladder, and urethra. In upper UTI, kidney and urethra. It's ascending route, and upper UTI have both, and it is more common, and upper UTI is less common. And predisposing factor that promote UTA in female, due to the short urethra and close proximity to anus, there is more chance of getting lower UTI than males. Presence of urinary catheters, urinary obstructions as occurs in prostate enlargement and or urinary stones leads to urine status. And in pregnancy, physiological obstruction in urinary tract due to growing fetus may lead to prolonged status of urine. In the asymptomatic urinary infection is common in pregnant women. And then diarrhea. Diarrhea, E. coli are antigenically distant from the commensals. Only few stereotypes which express enterotoxin or other virulence mechanism can cause diarrhea. There are six types of diarrhenic E. coli. First one is the enteropathogenic E. coli. It is frequently causes infantile diarrhea and occasionally causes sporadic diarrhea in adults. And it is a non-toxigenic and non-invasive. In enterotoxigenic E. coli, it is most common uh, cause of travelers diarrhea, causing 75 and 25 to 75 percentage of cases it causes acute watery diarrhea in infants and adults. It is toxigenic but not invasive. Entero-invasive E. coli, it includes ulceration of bowel and dysentery. It is not toxigenic but invasive. It is biochemically, genetically, and pathogenically closely related to Shigella. And then enterohemorrhagic E. coli, it is usually transmitted by contaminated foods. Example, undercooked ground beef, spinach, lettuces, etc. And enteroaggregative E. coli, intestinal colonization is mediated by aggregative adhesion fimbriae. Persistent and acute diarrhea are commonly seen, and especially in developing countries. And last, diffusely adherent E. coli, and it expresses diffuse adherence fimbriae which contribute to the pathogenesis, and it is capable of causing diarrheal disease primarily in children aged 2 to 6 years. And then other infections, in first one, abdominal infection. E. coli is the most common cause of both primary and secondary bacterial peritonitis. Pneumonia, especially in hospitalized patients, ventilator associated pneumonia. And third one, meningitis, especially neonatal meningitis, and it causes wound and soft tissue infections such as cellulitis and infection of ulcer and wounds, especially in diabetic foot. And then osteomyelitis, inflammation of bones by bacterial infection. And then endovascular infection and bacteremia. And the laboratory diagnosis, sample collection depends on the site of infection. You can see in the table column. And then direct smear of specimen by gram staining, and then cultural characteristic in blood agar and mechanical agar plating, and then cultural smear and motility testing, and then biochemical testing. This is the flat pink lactose fermenting colonies of E. coli on meconic agar. And the antimicrobial susceptibility testing, it is necessary to administer proper antibiotics. It is done on Muller Hinton agar by using disc diffusion method. E. coli can rapidly develop resistance to multiple drugs, and many strains of E. coli are producers of beta lactamases such as eosibel, extended spectrum beta lactamases, and EMBL, metallo beta lactamases. And then treatment and preventive measures, sorry, treatment and antibiotics. Antibiotic therapy by in vitro susceptibility and E. coli meningitis required third generation cephalosporins, and pneumonia, it requires respiratory support, adequate oxygenation, third generation cephalosporins or fluoroquinones. And preventive measures, appropriate infection control practices, it reduces the risk of nosocomial infection, and high hygienic standard will reduce risk of gastroenteritis strain, and the proper cooking of brief product can help, and washing hands through washing hands counters, cutting boards and utensils can help. Avoid raw milk and pasteurized dairy products and juices, and don't swallow water when swimming. That's all about the E. coli's general description, morphology, cultural habitat, cultural characteristic, antigenic property, and virulence factor, toxins, clinical manifestation, laboratory diagnosis, treatment, antimicrobial susceptibility, and preventive measures. And thank you. And this is the reference. I took three material as my reference. Thank you.